access professionals, otherwise known as registration representatives, use the communications technologies, persuasion, and presentation to effectively provide informed and accurate information to the healthcare consumer as well as other healthcare professionals. My intention in this presentation is to show how the successful use of these three techniques enable a healthcare access professional to ensure a uniform message, accuracy, and integrity in the healthcare environment. Recently, I interviewed Maura Costello, a coordinator in patient registration at Fletcher Allen Healthcare's main campus. As one of two coordinators, Ms. Costello oversees the ongoing training of 23 registration representatives that make up the main campus department. In addition, her duties include reporting to supervisors and managers both within registration as well as other departments of Fletcher Allen Healthcare, an organization of over 7,000 employees. Ms. Costello and I discussed the important role that communication plays in healthcare. Let me first explain briefly what a registration representative does. According to the National Association of Healthcare Access Management, otherwise known as NAHAM, patient access drives healthcare. We provide quality care in patient registration and all of its support processes to patients, providers, and payers throughout a patient's healthcare experience. Not only do we represent the first impression, becoming the face of the entire facility, but we also serve as the key component in putting every healthcare visit in motion. It all starts and ends with a patient access management, and we truly do pave the road to the success for our patients and our facilities. This means it's the responsibility of the registration representative to obtain the demographic and insurance information of a patient and to use this information to assist the patient in determining insurance eligibility in addition to potential copays and deductibles due. Maintaining accurate contact information in the event of an emergency and to inform patients of times and locations of appointments and procedures. These first contacts are most often done through Fletcher Allen's call center department. You may have received one of these types of calls in the past or are familiar with the formula of the call. Scripting is an important part of these face-to-face and telephone interviews. It's designed to create a presentation that is informative and follows the legal criteria necessary to maintain a uniform message, accuracy, and integrity within Fletcher Allen Healthcare. Verifying the healthcare payer Verifying the healthcare payer can often be complex and require the use of a payer website and phone calls by members of the registration department. E-commerce is a system specifically designed to use the insurance information entered into a patient's electronic health record to send a request electronically to verify insurance eligibility, copays, and deductibles due. This information is used to present information to the patient and create a persuasive conversation to encourage the patient to make a copayment. Oftentimes, patients are not aware of the details of their insurance plans, and the scripting and information gathered helps to educate the patient prior to arrival. Registrations teams who work directly with patients at the campuses must also verify patient identity, present patients with required legal, healthcare notifications, and persuasion to obtain signature prior to sending them to their procedures. Fletcher Allen uses many different types of technologies to communicate a patient procedure. Most recently, departments have begun working closely together to ensure positive patient experiences. This has meant the implementation of email groups set up to follow unique patient circumstances. This has proven to be very successful in creating a positive patient experience. Patients are given accurate directions and sent to the proper location at a time that they are most vulnerable. One example of this is the Breast Care Center group. These patients are now directed to registration based on the email notified of the patient's schedule without the need to review several different systems. A breast biopsy is difficult enough without being misdirected prior to the procedure. Another tool that is being used is an in-house website designed by the registration department trainers and accessible to all departments that allows important training information to be shared throughout Fletcher Allen. This site is constantly updated in the latest information and newest scripting requirements for registration representatives. Monthly staff meetings are used to present new procedures and to discuss potential strategies to improve both patient and employee experiences. These can be simple group discussions or more detailed PowerPoint presentations. There is also a monthly newsletter entitled Tidbits, with reminders of upcoming changes. Healthcare requires a lot of attention to detail, no matter if you are a surgeon or work in the housekeeping department. Each department works because of the other, and communication is the key to an efficient organization. Registration representatives at Fletcher Allen are using today's communication technologies, persuasion, and presentation to help ensure more knowledgeable healthcare consumers and professionals who feel that they are being given consistent, accurate information that is based on integrity.